Around the world, the challenges that palliative care are facing are numerous, and it is really individualized based on what country you're in. For the large majority of the world, it's really about access, both access to clinicians who are skilled in palliative care, but also access to medications that can be helpful.
It's always up on the agenda. We don't have a lot of funding. We don't have a lot of permanent funding as a service. That sense of continuity, being afraid that you might not be there for families in the way that you'd like to be. There have been tearful reflections of going, we just ran out of time, we didn't get there or whatever. So that can be an anxiety, I guess.
I think funding-wise, there's a big block around any services that we can increase in terms of allied health or medicine. Definitely the amount of people that we can reach, the services we can provide, outpatient clinics versus inpatient things.
The biggest issue for me is having enough inpatient beds in the particular area that I work in to manage patients who at various stages of their palliative care just cannot be managed at home.
I would change the fact that there's still such a taboo attached to it and still a scary or a dirty word, so that the whole public would see that it's as normal as giving birth or as another event in someone's life.
It's about making the principles of palliative care available to everybody through information campaigns, through the way that we enable discussions, conversations about death in society, to normalise it, to make it something that people find easier.
There's not enough discussion happening in society regarding death and dying and the process and how to best support both the person that is dying and their carer and family.
The stigma associated with the word palliative, often people don't know too much about it. We get late referrals because patients and family members really aren't wanting to accept what it might mean.
I think for me it would be about the community accepting death and dying more, and therefore supporting the process in the community more.
The one thing I would change about palliative care would be the awareness overall, so making it a known service. I think a lot of we're finding people are coming into the palliative care service towards the end of their palliative care journey, when really we could have been making a very big difference for people at the start. So just increasing awareness to people that it is the service that is there for them, and to link in with us as soon as possible.